Hi, my name is Jillian Geiger, and today I'm going to be removing an indwelling urinary catheter out of a female. So I have already performed hand hygiene upon entrance into the patient's room, and I have introduced myself as a nursing student. But I will be verifying her name, date of birth, and assessing her level of consciousness to person, place, time, and purpose. I will be assessing for any pain. She has reported no pain today, so now I'm going to go ahead and put the drape in a diamond shape for modesty purposes when doing this procedure. If the catheter bag was full, I would go and dump that out before beginning, but it is not. So I'm going to get the patient to lift up her legs, hoping that they will not fall off or outwards, because due to the fact that this is a mannequin, her legs do not hold still very well. Okay, I have one side wrapped around her ankle and tucked underneath her foot, and I'm just going to be doing that on the other side. Wrapping around the ankle and tucking underneath the foot. Okay, and then I'm going to take the drape and lift it up. If I need a little bit of extra slack, some can be taken. Her legs are not cooperating with me right now, but to get a clear view, I'm going to pull this up some, just like so, just like that. Okay, so now I'm going to perform hand hygiene again, open up my sterile field. I do have clean gloves in here, not sterile gloves, so I'm going to put those on. Okay, and I'm going to take a 10 milliliter syringe. Locate, well, it is wrapped around her leg. I would not do this on a patient if it was wrapped around her leg like this. I would fix it before touching her with my sterile gloves, but for the purposes of this demonstration, I'm not going to move it. But I'm going to attach the syringe and pull out all the liquid, because it is a 5 milliliter balloon. I will make sure that I can at least fill out 5 milliliters, but always have 2 milliliter syringe just in case. 2 10 milliliter syringes, excuse me, just in case, to make sure that, because there could be more than 5 milliliters, and there is not. So now I'm going to go ahead and I have already explained to my patient that there is going to be a little bit of pressure, but this is not supposed to be a painful procedure. So I'm going to go ahead and remove it by asking her to take some deep breaths. And I'm just going to pull it right out. As I said, it is wrapped around her leg, but I'm going to pick up the bag. I would not do this in a hospital setting with my gloves, but just to get this from around her legs, I'm going to remove the drape, and then I will be discarding of the Foley. I would typically have a basin to put it in, but for the purposes of this demonstration, I'm going to discard it in the biohazard container. And I'm going to go ahead and remove my gloves. And I would put on a new pair of gloves to perform perineal care on this patient before leaving the room. After that, I would resituate her make sure that my hands are clean by performing hand hygiene. And I would be back to check on her, informing her to use the call light if she feels the need to urinate. And I will be back to check on her in an hour or sooner if she presses a call out. Thank you.